Hello, welcome back to my channel. So today I'm going to try to start a nursing vlog on me precepting a new student who is about to graduate pretty soon. So basically what I'm going to do is every day, she has 6 different nights that she has to precept with me. So what I'm going to try to do is basically when I come home from precepting her, I'll try to go over the different things that we were able to do, different things that she was able to experience, whether she had a good night or a bad night. What can she learn from? What can I possibly try to do to help her get to the next level, and different things like that. So it'll kind of be like a reflection video after each day that she precepts with me. So today is for day 1. So I'm going to basically come back tomorrow and say my first not expectation, but my first impression of her. Is she gonna shy away from doing different things, different opportunities? Is she gonna ask questions, or is she one of the ones who thinks she know it all? Or, you know, basically my impression of her. And then I'm going to go over the different type of patients that she was able to experience and different things that she was able to do. So today is day 1 and I hope it goes well. Okay, so I'm back for a update on day 1 with my student. So we had 4 patients, 3 which were progressive, 1 which was a med surge. She was able to collect labs on 2 of those patients. We had another patient on the floor that was a trach patient, so we went in that room to assist that nurse to where she was able to suction that patient. She seems like she's very open and she's willing to learn. She communicates well. She was asking the appropriate questions. She was talking to others on the floor, which let me know that she won't be too afraid to ask questions if need be. The only thing, she doesn't have access to our computer systems to document and chart, where our other program that we work with, they have their own badge and they're able to chart, and we just have to go in behind them so that she can get a feel of charting. But I was able to log in to allow her to collect the information that she needs for her care plan at the end of the semester or whatever it is that she needs to do. But that was day 1. Okay, welcome back. So now I'm going to go over a recap of day 2 of my students' night on the floor. Last night I feel it was very productive. Again, we had 4 progressive care patients. One of them which was the trach patient that she helped the other night, but we actually had this as one of our patients. So she was able to suction a lot more. She was able to do trach care, change the inner cannula, the trach ties. We had to do a midline dressing change. He has a PEG tube, so she was able to administer medication through his PEG tube. Of course, he also had morning labs, so she was successful as gaining his labs. So I felt like he was our patient that had the most care done. She also had, we had a psych patient that actually came over from our psych facility, but she had to be medically cleared. She had some type of diagnosis, catatonic schizophrenia. So basically, I'm gonna get the correct name and I'll post it up there, up there somewhere. So basically, the patient goes through periods where she's at a catatonic state, where she doesn't move, she doesn't eat, she doesn't respond, like talk or anything. And I guess she had been doing that for a while to where it started affecting her health. So they sent her to the clinical side. From the psych side, they sent her to the clinical side for basically like failure to thrive, to make sure that, I guess, that she didn't suffer a stroke or whatnot. At times she would actually hold her urine. So yeah, I had to look up that particular diagnosis because I'm not familiar with that diagnosis. And then we had another guy. Unfortunately, he was a homeless guy, and they found him in hypothermic state. They said his temperature was 91 degrees, but he's doing fine now. And what was our other patient? Our other patient, he basically was waiting to be discharged the next day. He just had to have a good bowel movement. You know, us nurses, having a bowel movement, that's always a good thing, but he didn't have one on our shift, but we gave him the Miralax stool softener and everything, so hopefully he went today, and when we go in, we have a new patient in that room. But that was basically it. I say day 2, she actually gained a lot of experience doing different things. She is back with me tonight for day 3, and I just hope she keeps learning and growing, and I'm able to show her different things. Welcome to day 3 of my preceptorship with my student. So last night we had our same assignment, which is the 4 progressive patients, 1 being the trach patient, 1 being the psych patient, 1 being the homeless patient, and the other one being the guy who needed to poop. Yes, he was still there. So at this point, my patient who needed to have a bowel movement, they've given him numerous different things. They've given him enemas, they've given him Senecot, stool softeners, they've given him Miralax, and he just was not having a bowel movement. I guess he had a small one, but it wasn't enough. So at this point, they did a KUB on him, which is an ultrasound. I'll put the description. I never know where to point. I'll put a description somewhere. I just circle it somewhere in here of what a KUB is. And basically the results were that he had copious amount of stool. So in layman's term, he was full of SHIT, literally. So the goal for my student today was we're gonna make sure he have a bowel movement. Okay, so at 4 o'clock, the doctor prescribed him Go Lightly, which is a substance that we normally give to patients who is, as a prep, who's gonna go and have a colonoscopy or something like that performed on them, and they need to be cleaned out. So it's like a maximum extra strength laxative. I mean, when it cleans you out, it cleans you out. So her task was to continue to go in his room throughout the night to make sure that he's drinking, encourage him to drink more, you know, so we can finish this. Okay, so about 6, my student went in the room and she said, he's in the bathroom. I hear him passing a lot of gas, but I can't really tell if he's having a bowel movement. I said, okay, that's great. That means something is moving. That's great progress. So I gave him his time and I went in the room a little later and I was like, hey, was it successful? Did we have success? I'm giving him a thumbs up. He gave me a thumbs up. He was like, yes, I went. So I'm like, okay, cool. I go to turn to go look in the bathroom. He was like, oh, but I flushed it.
Oh my God.
Really? You flushed it? So I didn't witness this bowel movement that you claim you had. So I was like, why did you flush it? He was like, oh, I didn't know what to do. We've been telling you for the last 2 days. I know that I've been telling you for the last 2 days, if you have a bowel movement, I need to see it. I just need to see it. I don't need to inspect it. I don't need to, whatever you think we're going to do with it. I just need to see it. I need to lay eyes on it. So he claimed he didn't know, so he flushed it. I'm so disappointed. I'm so disappointed. So I told him that, I mean, the only thing that I could do is document in this chart that per patient, you had a bowel movement, but it wasn't witnessed. I said, so I don't know what they're going to do. Because at this point, you could be telling me anything just to go home. Which I think that's what it was. I mean, I couldn't really go by smell. I know this kind of TMI, but, you know, passing gas give out smell as well. So, I mean, I needed to see that. But, so I assumed that the next day that they were going to do another KUB to see if he still had a lot of stool in him or what. I don't know. But I will keep you updated. Hey guys, welcome back to day 4 and 5 of a recap of my preceptorship with my student. So we had 5 patients, and for the most part, they were all pretty easy patients, except for one where they were in respiratory distress, where we had to do extra workups on this particular patient, send them down for CTs of the head and chest, and then we actually end up sending her out to the unit. So she got the sense of what it is to notify physicians when things don't look right, to call the our rapid response team, to have a second set of eyes on this patient and to work the patient up and get the patient to a better unit that can provide more care for her. So we were able to do that. But also, my student told me that she wasn't comfortable with doing patient care, things such as changing the linen and bed baths and stuff. And from my experience, when I went to school 10 years ago, that was our term one, fundamentals of nursing. We worked with the PCA. We did the vitals. We did the AccuChecks. We fed the patients. We cleaned the patients. I mean, that was our clinicals. But apparently they didn't do this at that school. So basically all that night that's what we did. We did bed baths. We changed the linens. We put patients on and off the bedpan. When someone else patient called, I was like, hey, my student can do that. But I'm just thankful that she told me that she wasn't comfortable, because I just would assume that she was comfortable. And I'm glad she didn't have the mentality that that's not a nurse's job, when technically it is a nurse's job, because overall we're responsible for that patient. So for the most part, we were doing a lot of that. Of course, we still took care of our regular patients. We did the assessments, medication pass, and everything. We got that other patient out to the unit, but we did focus on patient care. So she has one more night with me, which will be Monday night, and we'll see how it goes. Hello, welcome back. Today is day 6, the end of day 6 of my preceptorship with my student. I just woke up from my shift last night. So it's Brooke's last night with me. So we kind of kept it basic. She did the medication med pass. She did the lab draws. We basically focused on IV dressing changes and central line dressing changes, because for whatever reason we had a lot that was due to be changed last night. And then she also had the opportunity to witness peritoneal dialysis exchange, or PD exchange. So that was pretty cool for her to watch. Overall, I think Brooke did an excellent job. I think she's going to be a great nurse. She asked the appropriate questions. I gave her a few tips on how to become a well-rounded, prudent nurse. I left her my information that she can use in the future as far as a reference, or if she just have any questions. And she promised to keep in contact with me, let me know when she passed her boards, and if she get hired somewhere, she's gonna keep me in contact. She did give me a thank you card, and it reads, "Thank you. Just 2 small words to express so much gratitude. Kenya, thank you so much for everything you have taught me over these last few weeks. Because of you, I am more confident in my nursing ability to be my own nurse. You're the best, Brooke." And of course, we took a selfie, and I'll put that down below. But this is just a vlog of me precepting one of my students, which I love to do. If you haven't, please subscribe to this channel, ring the bell, leave any comments, hit the like button, and thanks for watching.